Well, Health Minister Chen Shih-chung on Thursday said Taiwan was very close to finalizing a deal to acquire molnupiravir. It's a treatment developed by U.S. pharma firm Merck that has shown promise at treating COVID. Chen also said that 5 medical centers in Taiwan will be taking part in trials for a drug that could prevent COVID infection after exposure to the virus. Medical experts say they hope Taiwan's participation in the trials will speed up purchase negotiations down the line.
Earlier this month, Merck announced it had applied for emergency use authorization for an experimental oral use COVID treatment. Health Minister Chen Shih-chung says that the government has been in talks with Merck to acquire the treatment and could soon sign an agreement. Pharma firm Pfizer is also trialing a COVID treatment that may prevent infection among people who have been exposed to the virus. Several medical centers in Taiwan will be taking part in its phase 3 trials.
The trials have yet to begin as we presently understand it. We have asked them to report on the matter.
Trials for the Pfizer oral treatment will recruit about 2,660 subjects worldwide. The treatment will be administered with a low dose of ritonavir, a legacy medication widely used in combination treatments for HIV infections. 5 hospitals in Taiwan, including National Taiwan University Hospital, Far Eastern Memorial Hospital, and China Medical University Hospital, have been involved in a trial plan since early September. Experts say they hope their participation will speed up negotiations and procurement down the line.
Presently, the pandemic can be said to be in a more stable situation, so recruiting subjects has become more difficult these days.
Taiwan's vaccine drive is moving forward at full speed, with more than 4 million shots to be administered in the 12th round of vaccinations. With 2 administration phases and several brands being administered at the same time, some are wondering whether that's a recipe for errors.
It is recommended that the vaccines be administered on different days or different time slots. That way, you can be sure that there is only one kind of vaccine being administered during each time slot. That could prevent medical errors. Each vaccine's time slots were decided based on the availability of vaccine stocks as well as cold storage capacity at local government agencies and medical facilities. We had no choice but to divide up vaccination times. For the public, all they need to do is wait to be notified via text message and then make an appointment.
Minister Chen stressed that the government's priority was to administer vaccines as quickly as shipments permit. He says the system may have put burdens on local governments, but that meetings have been held to address any issues. Taiwan is on track to hit 70% first dose coverage and 30% second dose coverage by the end of the month.